dialogue on children and young people's crisis alternatives. Can we skip on to the next slide, please, Maggie? Oh, yep, there we go. So here's the Slido QR code that Lee just mentioned a minute ago, which is a great way. Oh, sorry, Maggie, can you go back one? Thank you. For you to join the discussion via Slido. And as Lee said, there's also the opportunity to use the chat and raise hands towards the end. We encourage everyone to participate during the session, and you can hopefully access the Slido either via that QR code or at slido.com. Thank you. Next slide. So just to introduce everyone who's presenting today. So as Lee said, my name is Nikki Smith. I'm the Assistant Director of Children's Strategic Commissioning at the Integrated Care Board, which is the commissioning arm of the NHS. We've also got Helen, if you give us a wave, Helen, who's the head of Children and Young People's Mental Health Commissioning, alongside me at the Integrated Care Board, and Maggie, you give us a wave, who's the Children's Commissioning Officer, again at the Integrated Care Board, who's making sure everything goes smoothly in terms of the slides and everything today, which is great. We've also got colleagues from Public Health from Derbyshire County Council. So James is here, give us a wave, James. And he's a Public Health Lead for Mental Health and Suicide Prevention. And similarly, Luke, if you could give us a wave, works alongside James as well. Brilliant, thank you. Thanks, Maggie. So just to give an overview of the session today, so we're hoping to give you an overview of the current services and the current provision that we have in Derby and Derbyshire. The public health perspective will be brought in from James and Luke, and an NHS perspective from Helen, Maggie and I, and in response to crisis. So in terms of some of the detail around the crisis alternative services that we and support that we offer, the who, what, where and why, we're talking about it, the conversations so far, and we'll talk a bit about innovation and collaboration and a vision for the future. Thanks, Maggie. So that brings us on to our first Slido of the session. So the question that we'd like you to consider: in 2023, how many children and young people aged 8 to 25 years in England were thought to have a probable mental health condition? And while you're putting that in, I will just say what we mean by probable. It's the estimated pool of children, young people and young adults who may already be known to services and in treatment. Some may be newly referred and some have yet to be referred, and it's an NHS England definition that's used to calculate children and young people's mental health occurrences. Okay, so 1 in 5 is just ahead at the moment, I think, and 1 in 10. Well, it was catching up, it's going back down again now. So at that point, I'll pass on to Helen. Thank you, everybody.
Thank you, Nikki. So thank you, everybody, for your estimates, guesses, or your knowledge on the question. So yes, I can confirm that I forget what the percentage was at the top, but 1 in 5 young people in England are experiencing a probable mental health condition. So those are NHS estimates, and the total across England is 1.4 million children and young people aged 28 to 25 with a probable mental health condition. These figures come from NHS digital data, and they're used by the Children's Commissioner and are used as part of NHSE when they're describing the the mental health needs of the population, or the prevalence of the population. So the Children's Commissioner, in their report, they also highlighted that there are higher levels of poor mental health among particular groups of children, particularly older teenage girls. I think at age 17, that spike sort of showed that was double the issue for girls than it is for boys, and particularly for children in care as another vulnerable group. And we also know that there are other vulnerable groups in our population, particularly those children with neurodiversity and young people from LGBTQ backgrounds. Next slide, please. So we just thought that it would be helpful for context to mention the mental health continuum at this point. So this is a model which some people may be familiar with, and it's the framework for understanding mental health and mental well-being and how they relate to each other. So if you look at from side to side, this is the mental illness continuum, and that describes the presence or absence of a diagnosable mental illness. And then if you look from top to bottom, that's the mental well-being continuum, showing at the top children who are experiencing good mental well-being, so feeling happy and flourishing. And then at the bottom, it's showing the children who are experiencing poor mental well-being, characterised by dissatisfaction and low motivation. So it's acknowledged that children in both of the boxes at the bottom may be feeling distress or in crisis. So when we're considering today those children and young people who are feeling distressed, we are referring to those in both of those quadrants of this model. And the other thing we want to acknowledge is that children are able to move between these boxes and able to move towards the top of the diagram, and with support and with strategies to be able to experience good mental well-being again. Next slide, please. So we also wanted to give you an overview of the strategic focus over the last 10 years that there has been to improve children and young people's mental health across Derby and Derbyshire, and to meet those needs of children on that continuum of mental health and well-being. And the work that we've been doing has been in line with the NHS priorities to improve access, to improve the experience of our children, and to improve their outcomes. And what you can see here is that there have been developments between 2014 and 19 along the Future in Mind programme, which particularly looked at building our early intervention and targeted support. So people may be familiar with the Changing Lives services, the Compass mental health support teams, and a range of other services that support that early intervention. And then we spent some time between 2019 and 2024, particularly focusing on enhancing the urgent care offer through development of the child adolescent mental health services at Derbyshire Healthcare and at Chesterfield Royal, to include a more robust 24/7 response and a community-based intensive support offer to really support our children in the community and prevent inappropriate hospital admissions. The bit in the middle, if you like, that kind of specialist CAMHS child adolescent mental health service, the core service, is the element that we're now looking at, and we're very much aware of the long waits in some of these services, and that's our current focus, to build that capacity within that element of the pathway. Next slide, please. So having described the kind of strategy behind what we're doing, we thought anybody that's not familiar to just describe the how the offer looks from the child's point of view. And we use the Thrive framework, which is a person-centred and needs-led approach to delivering mental health services and support for our children, young people and their families. The model was developed by the Anna Freud National Centre for Children and Families, and it's widely used across the UK. The model describes children in 5 categories. So thriving, the yellow circle in the middle, the children who may require getting advice and signposting, the green section, getting help in the blue area, and getting more help in the purple area, and getting risk support in the orange area here. And the emphasis is placed on prevention and also the promotion of mental health and well-being across the continuum as we've discussed earlier, and for the whole population. So children and young people and their families are empowered through active involvement in the access to resources, which you can see listed on the diagram, and through encouraging that involvement in their care through shared decision making, which is fundamental to the approach to getting the right care at the right time. So the aim is to enable children to thrive in the middle section, but for them to be able to dip in and out of the support level that they need as and when they need it. Next slide, please. So what we've done on this version of the Thrive model is we've added on the specifically commissioned local services that are available, and you on the copy that is available, you'll be able to click on each of the tiles and there is a link to those services. Next slide. Thank you. So we'll move on now to thinking a bit more about the definitions of mental health crisis. We're very mindful that when considering crisis, there's different perspectives. So we need to consider the child's perspective and their own definition, the carer's definition, the service offer definition, and also risk and the definition around that. So these differences shouldn't be barriers to children and young people reaching out to access support. And just acknowledge that a crisis can be defined as an acute, time-limited episode experienced as overwhelming emotional reactions to an event. What is a crisis for one person may not be so for another. And what becomes a crisis may not have been a crisis before, and it would not necessarily be a crisis in a different setting. So there's lots of different nuances, and the basis is that, you know, it's very individual, and it's that validation and that accepting of what the individual is feeling is what's important, and getting the right support for them at that time. Next slide, please.
Okay,
So
this is for me now. Hi. We've got another Slido question for you now. So thinking about the different definitions of crisis for children and young people, and using just one word, we're interested to understand from your experience, what are the factors which might result in children and young people tipping into emotional or mental health crisis? So if you go to the Slido question on your phone or computer, you should be able to type in just one word. So that's just using one word. And we're just asking, what are the factors which might result in children and young people tipping into emotional mental health crisis? Let's see if we're getting a few answers in. There's quite a few putting in trauma there. Bereavement. It's great. So we've got quite a few entries on there. That looks good. Thank you. So if we just move on. So what are children and young people telling us are the factors which lead to tipping into crisis and how they can get support? In 2023, an organisation called MH2K, who are a youth-led citizen researcher group, were commissioned to seek views from children and young people about their experiences of mental health and health inequalities, and how we overcome barriers to support them. MH2K recruited 25 young people as citizen researchers and engaged with 730 local children and young people to gain views. The link to their published report will be on the slide. Key themes that affected children's mental health were impact, sometimes of a traumatic home life, the lack of understanding from parents about their mental health, cultural barriers to accessing support, disproportionate impact on certain groups. Some groups faced more barriers, LGBTQ+ young people, those with long-term health conditions, and those from minoritised communities reported greater challenges and access barriers to support. Limited access to hobbies and interests. This suggests the importance of supporting young people's diverse interests as a coping mechanism to support their mental well-being. Exposure to toxic content online, and many young people talked about needing to support from a detox of social media or wanting to block online negative content. And last year there was a ThinkFest festival, which was run by Ellie at the Georgia Bird Foundation, in partnership with mental health providers, and it was held in Chesterfield Town Centre. There were many mental health stalls lining the streets providing information for Chesterfield shoppers. A workshop was held for children and young people where they were asked their views about mental health too. They were asked, if you were struggling with your mental health, where or who would you go to? Most responded they would go to trusted family, friends, a teacher, school staff, the mental health helpline, or even their pets. Then they were asked, if the sky was the limit, what would mental health support look like for young people? A summary of their comments are on the slide, including comments about education, transition, equality, training, and having a safe, comfortable place to go to with kind people to help you. So we'll go over to James now from Public Health. Thank you.
Good afternoon, everyone. So public health is mainly about prevention. So how do we prevent mental ill health in the first place? We tend to focus on the centre of the Thrive model, so the yellow and the green bits, which are around thriving and getting advice. So the key things for us really are about how do we build resilience? How do we empower trusted adults? How do we increase awareness of support? And we do that in a few different ways. So one is about equipping all children and young people with the awareness, the tools, and the confidence to manage their mental well-being, and also to play a role in supporting their friends' well-being. How do we support and enable adults, such as teachers, parents, carers, care professionals, football coaches, dance instructors? The list is endless. How do we help them to have the awareness, the knowledge, the skills, and the confidence to play a role in supporting children and young people's mental health? And all of these things help to provide the building blocks which help to prevent crisis. Next slide. So I'm just going to touch on a few examples of how public health lead bits of work to do this. One is around raising awareness. So this is really to help us decrease stigma and normalise conversations and thinking about mental health across our communities. So we do that by having campaigns, such as national campaigns like Time to Talk Day, which is coming up in a couple of weeks' time. We have local campaigns like Let's Chat, which is on the screen behind me. We try and have proactive communication out to people in communities. So we've got social media channels, we run newsletters, we hold public-facing events and organisation setting events as well. We develop and produce and share tools and resources. So some examples of what we've recently done are co-produce some booklets which focus on self-harm, focus on people with neurodiversity and their mental health, and focusing on managing anxiety. There's also the Rethink Mental Health Support Map. So this is a Google map which shows all the sessions, the services, and the groups that are close to people in our communities. Another way of providing support is trying to create a positive culture in key settings where children and young people go. So a couple of examples here. One is the whole school approach, which is a programme that is free to all schools in Derbyshire. And there are different components within that that support the pupils, support the students, and also support staff and parents. One example of delivery is the Smilers programme. You can see Walter the Owl on the image there. And that's kind of the 5 ways to well-being for primary age children. Another way is providing funding into community-based approaches. So some examples of that are the Children and Young People Social Prescribing Programme. So there's a programme delivered by Chesterfield Football Club called Thrive, and youth outreach work, which can be delivered by organisations in Derbyshire such as Blend. And the idea behind that is, how do we create positive community environments and pro-social opportunities for children and young people? The next one's around, how do we increase skills and confidence? So there's a broad offer of free training, including mental health first aid youth. So that's targeted at people who work or volunteer with those aged 8 to 18. There's the Zero Suicide Alliance as another example, which is a 20-minute online e-learning package, which gives good introduction to knowledge and awareness about suicide prevention. And then the final area really is around providing direct support. So Public Health commission the school nursing programme, which is delivered by Derbyshire Community Health Services. So they offer a couple of options, which includes in-school support for children and young people, and also Chat Health, which is a text messaging service. Next slide. So this slide just contains some useful resources for you. I will point you towards the Derby and Derbyshire Emotional Health and Wellbeing website, which is kind of a central repository of lots of links, lots of information, lots of direction to local services and support. So that you'll be able to access this through the slide pack. Next slide. And then Maggie mentioned MH2K already, and they produced some posters and a really empowering video. So you'll be able to access these through the slide set and on the Emotional Health and Wellbeing website. And we ask that you're able to circulate these through your own networks and share with colleagues and share with communities as well. So I'll pass now back to Helen.
Thank you very much, James. So I'm going to just pick up on the crisis response offer that we have from our CAMS team. So it's kind of the other end of the pathway, if you like, from the resilience and the community-based offer that James has been describing. So this is an expanded offer that is available for those children who are in mental health crisis, who require an immediate risk management support and stabilisation by a mental health care professional. You'll see the first green box on the left reflects the community support available, which as I say, has just been described. And when you have concerns that the mental well-being of a child or young person is reaching crisis, the green box on the right shows how to access that crisis support. So NHS 111, press 2 is key to remember, and through that route you will also be able to get to the 24/7 helpline and mental health support service, which you can access directly via the phone number which is on the screen as well, and there's a link to the website for the helpline. So the helpline offers it is all age, and there are phone handlers who have skills in how to support children and young people, and you'll receive their immediate advice and support and triage from those trained mental health workers who will be able to offer appropriate support, and it may be further signposting, or it may be that they link across to workers within the specialist CAMS services. They have that direct route through to the CAMS urgent care teams. The blue box shows the crisis assessment that then is delivered by the CAMHS urgent care teams. This is available 365 days a year between 8 and 10 p.m. in the community, either at a CAMHS base or at the child's home where the child is already named to CAMHS, or it's available through the children's emergency departments at both Chesterfield Royal or Royal Derby hospitals. Through the night, there is an on-call assessment available as well. The urgent care crisis teams offer that overarching assessment and brief interventions around safety planning and support that will be provided. Then, as and when appropriate, it might be that young people require a more intensive support offer, and then they will be referred into one or more of the orange boxes, which are the more intensive support offer available, with the intensive home treatment team offering therapeutically informed tailored interventions, which might be delivered over a few weeks. There's also the day service, which is available for those young people who may be at risk of admission to a mental health hospital. And when, as appropriate, it might be that some young people, when require a mental health assessment and treatment within an admission and within a CAMHS inpatient specialist bed. Next slide, please. So having described the broader context of the work that's going on and the pathway, we wanted to now focus more on the crisis alternatives and the conversation for the dialogue. So, well, who are we talking about? We're talking, as I said, about those young people who have perhaps been described as bubbling or tipping into crisis. You've shared on the Slido some of the reasons that young people might tip them to feeling that they're in that level of distress. It may be trauma, maybe bullying, it could be bereavement. There's any number of different causes. As well as you can see on the slide, we've got low mood, self-harm, thoughts of suicide, isolation, lots of distressing feelings that our young people are experiencing. Where are these children and young people presenting? As I've mentioned, those first contacts are often at school and in local GCSE kind of local groups, perhaps hobby groups, interest groups, so all those community venues and social activities. And from talking to children and young people, as we've said, the place where they're often going to seek that support is from a trusted adult, who is most usually a parent, a teacher, or a youth leader. So why offer alternatives? What we're looking at is how we can really support and head off a crisis and improve the experience and the outcomes for our children and young people. Next slide, please. So when we're talking about crisis alternatives, we're describing the offers which might hold and support children and young people in the community and help to prevent that escalation of distress. So we started this conversation in a number of different forums. As Maggie's described, we had workshops at the Chesterfield Think Fest. We've been meeting with some key professionals and key local organisations to start the conversation. And what we're looking to do is to really seek how we can better identify and support those young people who are tipping into crisis. We're looking to ensure that support is available, which stems that crisis and stems the escalation of distress, and to make sure we can support young people with the right care at the right time and in the right place. And one of the key things that we're looking to do is to improve those connections between the different offers across Derbyshire, because as you've heard within the presentation so far, there is a lot of support out there. There's more, even more than we have talked about, and there's the organisations that people on the call will be representing. I'm sure we'll be able to offer a lot a lot further support as well in different ways. Next slide, please. So the way that we're looking to bring these connections closer together and to our approach to improvement is by engaging and listening to people, which is the purpose of the dialogue and the conversation that we want to have. We've been examining some case studies to really kind of understand where connections can be better improved across the offers and across the community, and most importantly, hearing experiences from children, young people, and from trusted adults and professionals working with our children. We're also keen to understand what's available and better connect those offers together. And we're looking for innovation and collaboration as well. So enhancing what works and bolstering the initiatives that are already out there that are working, and growing those networks for in the community, centralising resources and exploring the different solutions that there may be. We're also really keen that we look at how we can best support the trusted adults, because we know that it's trusted adults who are whose resilience can, maybe being tested. It's trusted adults who are trying their best in some of these circumstances, and it's making sure that they feel supported and they feel that they're doing the right things. Okay, next slide, please. So key to the strategy and key to what we're looking to do is obviously communication. So wanting to make sure that we're reaching out and communicating the offers available, and that people know where to find support. So promoting a shared understanding around information and the key messages is really important to make sure that the right information gets to the right people at the right time. Okay, we're going to, if we move on to the next slide, please, Maggie. So we have final Slido question for everybody. So what we'd like people to do is to drop a word into the Slido that describes or starts to describe what could make the biggest difference for our children, young people and trusted adults when the child or young person is tipping into crisis. So what could help to improve things? What would make things better? What else might help? I'm sure there's lots of things that people can think of. And see, got various participants typing away. Recognition, I think, comes up a lot. That validating people's experiences. Provision, trust. Yes, young people talk about how important it is that they find the right person that they can trust. Alternative helplines, interesting. Family support, safe spaces, continuity. Yeah, which links back to trust, doesn't it? That speaking to the same people. Community being really important. There's lots of ideas coming in now. Thank you. I'm going to move on, but we can come back to this, can't we, Maggie? If we move on to the next slide, and then when we start the discussion, we can pop this back up again.
Yeah, okay.
Is that right? Yeah, okay. So if we, I'm just looking at the time because I want people to have time to be able to share their experiences and their views. So that's the end of our presentation. And thank you ever so much for listening and for your participation so far. What we'd really like is for people to, any questions we're happy to discuss. But then there's also a link to a survey that we would ask people to have a little look at. So we'll use the same questions in the survey for the discussion now. Because what we're thinking is some people might be happy to come and talk on the screen. Some people might want to put their views into a survey. So it's very similar to the last Slido question. What we're asking is what's helpful for our children and young people when they're tipping into crisis? what are the things that are helpful, and then what are the things that are less helpful. And then for our trusted adults, what are the things that are helpful when young people are tipping into crisis, and what's less helpful, and what are the things that we can learn from that. So thank you very much. Do you want to?
Brilliant.
Thanks, that's me. Do you want to pop the Slido back for a moment or two, Maggie, and then that gives people a chance to just reflect, and then if I'll let you take over, Lee, from here.
Brilliant. Thank you very much, and thanks all for that presentation. Really useful, lots of information. We've got the cavalry out of 5 presenters, so I can see a lot of the questions being answered as they came in the chat, so that's fantastic. I don't think there's an outstanding question that hasn't been answered. Is there, would anyone like to raise a hand or pop a question in the chat box now? Either to expand on one of those or anything about the presentation, all the things that were covered that anybody may like to ask. Give it a second just in case anyone's typing or whatnot, but if not, we can always kind of talk. This is a really good slide we've got up now, and kind of talk over some of these things that are coming through. Again, if anyone's got anything to input on those above and beyond a word. Samantha.
Hi, I'm being really brave here, but something is sort of pulling on my heart a little bit. I work for Compass Changing Lives, and I'm an EMHP. It's sort of an observation, I think. I think when we're working with the neurodivergent community, our framework of that short term sort of 6 to 8 weeks intervention, there's some good work being done, and we can adapt our interventions to meet the needs of those young people. But I just think beyond the intervention, I always wonder where they go and what sort of happens. And I suppose they don't capture that information, but I do think that there is a risk of relapse with that community. And if there was some scheduled support in the future, maybe a 2-month check or a 3-month check, just to check in, that we might sort of prevent a dip within that community. And I'm only talking from the Compass Changing Lives model here, and I've not shared that with anyone in my service because it's just struck me now, and I may take that further. But I suppose we're commissioned to do certain things, and I just think sometimes I know we don't really work outside of our commissioning, or from my understanding, but if there was some follow up with that community, it might prevent a relapse, or it might maintain that support and maintain that intervention work. I hope that was relevant.
Very, very relevant. Thank you ever so much, Samantha. That's really, really important point that you've brought up, and something that people do talk about a lot. It's that step down, isn't it? After young people have received some treatment and they've had some intensive support, it's then that step down to whether it may be kind of pro-social activities, or within schools, within the local community. And I think that's one of the things that we've, if you're familiar with the specialist community advisors and the SCARs that are in each of the localities, if people aren't familiar with them, they're professionals who are based within CAMS services, but they're that link between the kind of service offer and the wider community. And I know they have, particularly in the north of Derbyshire, I know they have very broad networks within the localities, and whether that's some of what they might be able to help with. And I think it's like you say, it's how we make the whole pathway much more resilient and robust for people, isn't it? So it's not a case of, it's not linear that young people go for treatment and then come back again. It's back to that thrive. It's being able to offer that wraparound support and people be able to have those strategies and that network around them when they need it. Yeah, I can see we've got comments in the chat about different charities supporting young people when they're struggling, and kind of it's well, saying not waiting well. Let me read this properly.
I think it's around, are we capturing the information from charities that are supporting people who aren't waiting well, and are we receiving that in the ICB? Is it been fed through? Are we aware of the kind of scale of that? I
think where that's part of the conversation that we've been opening up, and some of the network with the VCSE, the network that Rachel Bounds has been is the Derbyshire Voluntary Sector Alliance, is it, that network? And I think that's where some of that information would feed into, and they've been very much involved in supporting how we can develop this conversation. But that's definitely one of the things we're looking at, is how can we quantify some of this, and how can we really sort of see what is happening.
Real, thank you. Picking up from the chat again, Helen says, I'd read in a JUCD board report that waitlists for children and adolescent mental health services is improving. Can you expand on this, please? I don't know who'd.
So I think there's various data around the CAMHS, and I think what we have seen from there was in I'm thinking back 22-23, after the COVID pandemic, we had really significantly high waiting times for young people with specialist CAMHS services, and the picture has improved. So both our CAMHS services at North Derbyshire, Chesterfield and Derbyshire Healthcare did an awful lot of work during 2023-24 on redesigning their services and looking at how they triage referrals and the support that they give, and they've streamlined their processes, which have helped to an extent, and have helped to reduce some of those waiting times, because some of them were over 2 years, and they are they're still long. They're not where we want them to be. I don't think we've not got many children waiting more than a year anymore. We certainly haven't got any waiters more than 76 weeks. So it has come down, but it's obviously not good. So that's where that board report would be reporting something that is going in the right direction, but it's certainly not where we want it to be.
Thanks, Helen. It's Helen. I was just asking that. Hiya, Helen. I was just asking that question because, I did notice it in that board report, and I was wondering as well, because you've made some changes in terms of almost adding different arms within CAMHS, for different types of problems, whether that is, started to follow through now in terms of, young people seeing the right people at the right time, really. So, it's probably, like you said, it's probably not exactly where we want it to be, but maybe it's heading in the right direction.
Yeah, I think there's an element of when at the beginning, where I talked about the last 10 years and all of those developments. I think one of the things is, we know that at the beginning of that 10 years, only about 25% of children who had a mental health need were able to access a service. So now I think we've got nearer sort of 60+% of young people are accessing a service, which is great, and that's what we want. But then it's also, there's more young people needing a service. The very first slide, the 1 in 5 children now needing support. So it's how it balances, isn't it, across that whole picture.
Excellent.
Is there a question for anybody else? I'm just wondering if anybody else wants to come in.
We've got one in the chat from Laura from the Neuro Hub. Let's just disappear off my screen. Where would you suggest for where children, young people would go when parents have used all services like the hubs and Compass, but get turned away from CAMHS?
It's very difficult without knowing the individual child and what their needs are, and because I think this is it. It's about building that support around the young person, and so having gone through those different services, I'm sure there will have been offers made of support. So it's I guess it's trying to understand if they're not working, or what the gaps are for those individual young people, isn't it, I think?
And if it comes to an individual response, following the meeting, there'll be kind of the post-meeting notes, slides and whatnot, but there'll be a contact point. So if there's any individual scenarios that people want looking into, please do respond to that email, and we can look into. I appreciate sharing individual cases on the call, might not be right now. I'm aware we've got just over 5 minutes left, and there's some more stuff coming in from the chat. I'm reading some stuff from Sarah at the moment.
And just pick up, it says, just pick up one that says, do children and young people know where to get help? So that's very much the poster that James was sharing. It's about, the emotional health and wellbeing website. We promote that in schools. COOS have engagement liaison staff who go into schools. We promote using the 24/7 helpline. So those are all accessible for our young people directly. I think it's back to that, what we're saying about communication. It's that repetition to make sure that our young people know which are the good standard offers, if you like, because there's so much out there, isn't there, on social media. So that's what, it's really wanting people to support sending out the messages from public health, because we know that they are the good quality resources, that they're supported by our clinicians and our providers.
Thank you. I don't know if you just want to take a second to read the chat rather than me try and read this out verbatim. I'm looking at the one from Sarah at the moment.
Well, there's more appearing, so I can't see which one you're looking at.
Sorry. So, how are the local parent carer forums and peer support for parents looking locally? I feel that acknowledging parents as the main stakeholders and carers for their children and young people is key to target education, support in community and family with the long game in mind. Especially with ND, these parents are often exhausted and lose the will to know where to get help. Do we need to include education in this conversation?
Absolutely. Whether I don't know if anybody else wants to come in there. I think people are busy typing, responding to other questions. But some of the resources that James was talking about with the whole school approach, Compass, who Sam came on the screen, that work very much into schools and working with education. And as you said, that's the network for our children, isn't it? Is the schools and teachers, and really enabling them to feel that they're in a good place to be able to support our children. I think all schools have mental health champions, and there is a network for them to be able to around training and getting resources and linking into the pathway. I think some more of that question with parents, absolutely. We have the parent carer forums for both Derbyshire City and Derbyshire County are very well established now, and they particularly have good links around the neurodiversity work and those pathways and linking with the providers of the hub. I don't know if anybody else wants to come in any more about any of that.
I think you've covered it off, Helen. So as you said, we do have those links, particularly around neurodiversity work, but absolutely education settings are the place where all our children are, aren't they, as assistants? Thank you.
Great. And I can see there's kind of a mini Q&A going off in the chat. So for the final question, I'm just going to, which is brilliant because everyone's getting individual responses to their questions. But for the final question, I'm just going to bring Leslie in and then we'll wrap it up.
Thanks very much. Really, really interesting presentation. Thank you. Now in Glossopdale, we do 2 community events a year. And I'm just thinking that this might be a very good event for our May event. Presumably you're still looking to get engagement with the public to get feedback about their experiences and their views on what they want. Yeah? Would you be happy to work with us and attend and join in with this? Because I think it's really important. We could do something to really support what you're doing.
Oh,
that's
that
what we
sounds
want to
really
do.
good. Yeah, happy. So my email address is on the end of the presentation. But then I think if you link in with Lee, you'll be able to connect us up and have that conversation outside of the meeting. That would be good. Thank you.
I will definitely
That's a great
link in
offer.
with Lee and James. Thank you.
Thank you.
Brilliant. Thank you very much. Well, I'm going to bring an end to the session then. I will comb through the chat box after and just check if there's anything that hasn't been answered then. And we'll pull it together in a document, if so, that'll come out with the kind of post-attendee slides and recording and things like that. Thanks to our BSL interpreters today, and thank you again to the presenters and for everyone that's attended the session. I'm just going to do a shameless plug of the next session in the chat and then read it out like a robot, which is Working Together for Fairer Health for All, which is a session that will briefly cover why we need fairer health and then focus how we can move from data to action. The session will include a range of speakers, each sharing examples of how they are doing things differently to help make health fairer and the learning from this. And I'm just going to finally pop the link to Derbyshire Dialogue Central Resource online, where all the information from past and future sessions can be found. Thank you very much to all, and have a great afternoon. Bye-bye.
Thank you, everybody.
Thank you, everybody.
Thank you.
Thank
Bye-bye.
you.
Bye-bye.
Bye-bye. Thanks.